Hello and welcome. Today we're diving deep into a condition that affects the bladder, Detrusor underactivity, also sometimes referred to as an underactive bladder. This isn't something we often hear about, but it's a real issue for many, significantly impacting their quality of life. We'll explore what it is, what causes it, and how it's managed. So, what exactly causes Detrusor underactivity? Well, it's usually a complex mix of factors. One common culprit is nerve damage. This can stem from conditions like diabetes, multiple sclerosis, spinal cord injuries, or even stroke. These conditions can interrupt the signals traveling between the brain and the bladder, preventing the detrusor muscle, the bladder's primary muscle, from contracting effectively. Other potential causes include aging, chronic bladder overdistension, certain medications like anticholinergics or opioids which can weaken bladder contractions, pelvic surgery, and even long-standing constipation. Sometimes the exact cause remains unknown, which we classify as idiopathic. Now let's delve into the pathophysiology. What's actually going wrong inside the bladder? In a healthy bladder, when it fills with urine, sensory nerves send signals to the brain. The brain in turn signals the detrusor muscle to contract and the sphincter muscle to relax, allowing for complete and efficient emptying. In detrusor underactivity, this process is disrupted. The detrusor muscle either doesn't receive a strong enough signal, or the muscle itself is weakened, leading to ineffective or incomplete bladder contractions. This results in urine retention within the bladder. Understanding how common detrusor underactivity is can be challenging, as it's often underdiagnosed or misdiagnosed. Accurate estimates are difficult to obtain, but studies suggest that it becomes more prevalent with age, affecting a significant percentage of older adults. It's thought to be more common in men, potentially linked to conditions like benign prostatic hyperplasia, or BPH, which can lead to chronic bladder outlet obstruction. However, detrusor underactivity can affect anyone, regardless of age or gender. The signs and symptoms of detrusor underactivity can vary from person to person, but there are some common indicators. Frequent urination, both during the day and night, is one. Individuals might also experience difficulty starting a urine stream, a weak or intermittent stream, straining to urinate, or feeling like they haven't completely emptied their bladder, a sensation known as incomplete emptying. Urinary hesitancy, the need to wait before being able to initiate urination, is another possible symptom. In severe cases, it can lead to urinary retention, the inability to urinate at all, which is a medical emergency. Diagnosing detrusor underactivity involves a combination of methods. A thorough medical history and physical exam are crucial. Post-void residual volume measurement, which determines the amount of urine remaining in the bladder after urination, is typically performed. Aerodynamic testing, specifically cystometry, is often the gold standard. This test measures bladder pressure and function during filling and voiding, helping to identify weakened detrusor muscle contractions. Other tests may include urine analysis to rule out infection, and imaging studies like ultrasound or cystoscopy to visualize the bladder and urinary tract. While detrusor underactivity doesn't have distinct types, in the same way some other diseases do, it can be classified based on its severity and underlying cause. For example, it can be categorized as mild, moderate, or severe depending on the degree of urine retention and the impact on daily life. It can also be categorized as neurogenic if it's caused by a neurological condition, or idiopathic if the cause is unknown. Understanding the severity and underlying cause is important for guiding treatment decisions. The treatment and management of detrusor underactivity aims to improve bladder emptying and prevent complications. This often involves a multi-faceted approach. Clean intermittent catheterization, or CC, is a common method where the patient inserts a catheter to drain the bladder at regular intervals. Medications like buthanecol, a cholinergic agonist, may be prescribed, although their effectiveness can be limited. Sacral neuromodulation, a procedure that stimulates the nerves controlling the bladder, is an option for some patients. Surgery, such as bladder augmentation or urinary diversion, may be considered in severe cases, but these are typically reserved as a last resort. Lifestyle modifications, like timed voiding and double voiding techniques, can also be helpful. Preventing detrusor underactivity isn't always possible, especially when it's caused by underlying medical conditions. However, there are steps you can take to reduce your risk or slow its progression. Managing conditions like diabetes, maintaining a healthy weight, avoiding chronic constipation, and practicing good bladder habits, such as not holding urine for extended periods, can all contribute to bladder health. If you're taking medications known to affect bladder function, discuss potential alternatives with your doctor. The prognosis for detrusor underactivity varies, depending on the underlying cause and the effectiveness of treatment. With proper management, many individuals can experience significant improvement in their symptoms and quality of life. Recent research is focusing on developing more effective medications and neuromodulation techniques. Gene therapy and regenerative medicine approaches are also being explored as potential future treatments. Researchers are also working to better understand the underlying mechanisms of Detrusor underactivity to develop more targeted therapies. Continuous research efforts give hope for improved outcomes and a better quality of life for those living with this condition.